Hello and welcome everybody. I'm Anthony Gonzalez and I'm the Senior Program Coordinator with the Higher Education Center. And I want to welcome you all today to our webinar titled Preventing Collegiate Impaired Road Use, a Holistic and Student-Inclusive Approach, featuring our very own Elizabeth Branham and Paige Carter. Before we get started with today's content, I do just have a couple of housekeeping slides I'd like to share with everybody. Here on the screen should look somewhat familiar as we are in the Zoom webinar format. We do welcome your questions at any time throughout the live session, but we do kindly ask that you utilize the Q&A feature. Additionally, we have the chat enabled, so feel free to introduce yourself and share where you're joining us from, along with any resources and reflections on the shared content. But again, we kindly ask that you utilize the Q&A feature for any specific questions for our presenters. We also encourage everybody to learn more about becoming a member of the Higher Education Center. You can learn more about the different membership tiers and the benefits that go along with them by visiting our website at hecaod.osu.edu. I'd also like to share a few upcoming opportunities with the center. Our next webinar will be taking place next week on May 21st and is featuring our very own Logan Davis and is an in-depth look at screen view. Additionally, the HECAOD Training Advisory Committee applications are now open, and you can learn more by visiting our website, and I will drop a link momentarily in the chat of the landing page on our website. Those applications are open until June 6th. And additionally, we have the 2025 national meeting taking place both virtually and in person in Columbus, Ohio in October 21st to the 23rd. And we have early bird registration running until July 18th. And with that, it is my great pleasure to turn it over to my friends and colleagues, Elizabeth Branham, Traffic Safety Specialist here at the Center, and Paige Carter, Traffic Safety Data Analyst with the Center. Thank you both for joining us, and it's my pleasure turning it over to you at this time.
Thanks so much, Anthony. Hi, everybody. It's great to be with you all today. As Anthony shared, my name's Elizabeth Branham, and I'm a Traffic Safety Specialist here at the Higher Ed Center. And I'm just excited to hop into our topic today to share more about traffic safety and impaired road use prevention among the college population. Please do introduce yourself in the chat. It's great to see where everybody is joining us from today. So our learning objectives for the webinar today are as follows. We aim that by the end of the webinar, you will be able to assess how your campus environment may contribute to the risks associated with impaired road use, risky traffic behaviors, injuries, crashes, and fatalities. We additionally hope that you can explore how traffic safety and impaired road use prevention initiatives align with your roles and responsibilities where you currently are at. And then lastly, that you can identify actionable strategies for integrating traffic safety work into various campus wellness initiatives that you have going on, including how impaired road use data can engage students as active contributors to prevention efforts as key partners in this work. So we'll be talking throughout the webinar today about traffic safety and impaired road use among the college population, but this might be a topic that you are familiar with, or it might be something that is new to you. When I think about traffic safety among the college population, this is what I am picturing in my head. This is a photo of my alma mater, Boise State, specifically the walkway that leads into the quad on campus. And as you can see, students are using a wide variety of modalities to travel throughout this area. We have some bikers, we have walkers. Maybe some of these students parked at the nearby park and walked onto campus to avoid parking fees, or maybe they live on campus and they bike to class. Maybe out of shot is somebody on a motorized skateboard or a rented scooter. If you look a little further into the distance on the left, you can see this lighting pole. This actually has a small little yellow sign that's asking students and other community members to dismount from bike, scooters, and skateboards as they head into the quad. This sometimes happens and sometimes it doesn't happen. There's sometimes near misses between bikers going really fast and pedestrians in the quad area. On this campus, students are not required to live on dorms at any point. So a lot of students do drive, bike, and walk to campus from off campus. And this is a photo of Boise State, but this is probably a very familiar scene to you on your campus. I'm sure you can think of an area as I'm describing all these different things that is similar on your campus. And sometimes people are using transportation in safe ways, and sometimes there's specific risks that can pop up as well. This photo is from my current institution, Ohio State, where it's located in Columbus, Ohio. This is High Street, which is a part of a busy entertainment and arts district with lots of bars and restaurants that students frequent. I actually live outside DC, so I'm not in Columbus, but I'm told that this is a really popular area for students to visit while at Ohio State. Like students at OSU, much like at Boise State, they use a wide variety of methods of transportation to get around off their campus into areas like High Street using bikes and scooters. Maybe this car here on the right that we see in this picture is full of students heading out for the night looking for a parking spot on High Street before they head to the bar. Did they pregame ahead of time? Did they predetermine their designated driver? If they did they clarify what the expectations were of that designated driver? Does that mean that that person will only have 1 to 2 drinks early in the night and then stop drinking at a certain point? Or does that mean that they will stay completely sober for the entirety of the night? Maybe some students here on High Street walked the mile or so from campus in a group at the end of the night. How are they going to get home? Did they talk about that in advance? Are they going to walk home? Our law enforcement partners in this work do tell us that there are dangers in having impaired students, walking around. They can walk into traffic. They take more risks than they would while sober. What about a student who took a scooter to get to High Street? They might perceive being impaired on a scooter to be a less dangerous option, but it can still put other road users at risk and is also illegal. So I'm just curious, as I'm describing this photo, you can think to yourself, what does this area look like on or near your campus? Do you have a busy section of campus that poses a traffic safety risk? Do you have an entertainment district that students frequent that you feel like, really increases the risk for impaired road use among your student population? I also want us to consider that, this photo in this area in Columbus is not the Ohio State campus, but these are still Ohio State students, and their safety and well-being is still our priority, even when they are off campus. You'll notice throughout this presentation, hopefully, that we are aiming to say impaired road use and not drunk driving. And this is because for college students, cars are not their only form of transportation, as I have been demonstrating in the previous photos. This is some data from a survey that we conducted of 18 to 24-year-olds in Ohio, both enrolled and not enrolled in college courses. Over 52% of respondents enrolled in college courses reported biking in the past month, 30% reported scootering in the past month, and 17% reported skateboarding. And as we can see in this chart, these percentages are higher than among their non-enrolled peers. As I also outlined, college students are using these forms of alternative transportation or micromobility while impaired, which we see demonstrated through this data. Of college enrolled students who biked, 46% reported alcohol impaired riding. Of enrolled students who scootered, 49% rode while impaired. And of enrolled students who skateboarded, 51% of them rode while impaired by alcohol. These statistics are similar for cannabis impairment as well. Of college enrolled students who biked, 46% reported riding under the influence of cannabis. Of enrolled students who scootered, 45% rode while impaired, and of enrolled students who skateboarded, 54% of them rode while impaired by cannabis. The survey that we have conducted a few separate times now also asks students if they have experienced a negative or dangerous event while riding a scooter, bike, or skateboard. And many respondents reported being hurt. Someone said, yes, I hit my head pretty hard and passed out. I fell off and hurt my arm. But I also want to highlight that in addition, these students also reported near misses, such as being almost hit, someone almost ran into me, or seeing somebody else hurt, that second line, as negative experiences as well. So even if students are not being physically injured themselves, they perceive other people being injured and almost being injured as dangerous events, and this then impacts how they perceive the overall safety of campus. So at this point, we would love to hear from you in the chat what your experiences have been like on and around your campus. In terms of traffic safety accidents or dangerous events, what have you seen? What have you heard from students? What have you experienced while on campus? Is there an intersection where students commonly crash? Is there an area where ride shares come to pick up students that's causing issues for pedestrians? Have you had a near miss? So go ahead and pop that in the chat and I'll share some of those out with the group. We always share stories back and forth when our team's together about various incidents that have happened on our shared campuses. I know skateboarding is a really big element at San Diego State where Dr. Lang is. Jan said students running at dusk. Yes. Yeah, that can be dangerous for sure, especially if there's jaywalking or jay running involved in that. Thanks for sharing, Jan. Someone was crossing the street with headphones and was hit by a car a few weeks ago. I'm sorry to hear that, Sarah. I'm glad to hear that she was okay. On a street with speed bumps. Yeah. Speedy scooters and electric bikes. People driving as if they're in cities. Sorry to hear that you're afraid when walking home. Scooters being really fast. Lots of near misses. Yeah, near misses is a really common theme on campus among students and staff as well. And that's the other piece of this. It's not just about students, it's about how staff and faculty feel on campus as well. Keep sharing your stories, everybody. I appreciate that. All of these stories and our perceptions of campus and these different themes help us to understand what's going on our campus around traffic safety. So I'm going to switch gears a little bit now and talk about the common barriers to addressing impaired road use that we see. When we talk with campuses about this issue, there's a couple of responses that sometimes we hear about why this might be challenging to address on their campus. And the first thing that we hear is, well, our students don't drive on campus. And this might be because there's limitations to who can have cars on campus. Maybe only upperclassmen can have cars. But eventually, students will move off campus for the most part, and they will become upperclassmen, and then they will have the ability to have cars. And oftentimes, upperclassmen still make up a good portion of your student body, so I think that is still relevant with car use. And we also see, in addition, from our survey that we conducted, that students do have cars, and this was a survey done in Ohio, but we've also seen among the universities that we work with in metropolitan areas like DC that students are driving. So we saw that more people of the same age who were enrolled in college campus courses were driving compared with people who were not enrolled. So the second thing that we might hear is, this is not a problem on our campus. This is not something that we deal with. And this can mean that people are not collecting data on this issue, which doesn't mean that the problem's not occurring. It could also mean that you're not seeing these behaviors happening physically on their campus. Impaired road use is more likely to happen off campus than on campus proper, and a lack of communication between campus and community police could mean that these incidents are never reported to administration if there's not that relationship between those entities. So it really is crucial with impaired road use to be utilizing partners beyond the campus to address this issue. And then lastly, something that we often hear is, didn't rideshare services like Uber and Lyft solve this problem? And I think it's important to highlight that impaired road use goes beyond just having access to alternative methods to driving, because if that was the case, then we would have solved the problem, and unfortunately we have not. In 2023, someone died in a drunk driving crash every 42 minutes. Drunk drivers claimed the lives of over 12,000 people that year. In 2022, 30% of drivers who were fatally injured in a crash had a VAC of 0.08 or higher. We also know that the 21 to 24-year-old age category, so we're thinking, juniors, seniors, and grad students on your campus, that category was the highest percentage of drunk drivers in 2023. National College Health Assessment reference data from fall 2024 revealed that of students who had both driven and drank in the past 30 days, 11.3% of them drove after drinking any alcohol. Of students who had both used cannabis and driven in the past 30 days, about 1 in 4 of them drove after using cannabis. We know not as many students are using cannabis as are drinking, but of the students who do choose to use cannabis, more of them are choosing to get behind the wheel. And then from the Monitoring the Future panel study, we know that among those attending four-year colleges between the ages of 19 and 22, 16.7% of them reported driving under the influence of any alcohol, driving after consuming 5 or more drinks, using marijuana, or using illicit substances in the past 2 weeks. This chart depicts the percentage of traffic fatalities in each state that involved alcohol. So you can find your state on this list and see, how it compares nationally. We are doing impaired road use prevention work in some of these higher risk areas right now, including DC, Ohio, Illinois, and New Jersey, amongst others. Impaired road use prevention is a fairly new field. Efforts really began in earnest in the early 80s with the establishment of Mothers Against Drunk Driving and Reagan's Presidential Commission on Drunk Driving. Prior to these efforts, nearly 25,000 people were killed in alcohol-related crashes, and that represented half of all traffic deaths. So much great work has been done since then, including public health campaigns like the Friends Don't Let Friends Drive Drunk campaign, which, as Jason Kilmer reminded us in the last Learning Collaborative, was instrumental in achieving a 10% decrease in alcohol-related fatalities between 1990 and 1991. And that was the single largest one-year drop in alcohol fatalities that was ever recorded, which is pretty amazing. Other public health campaigns have also happened around in the last 40 years. And there's also been legislation that's moved the issue along, such as lowering the national drinking age, lowering the legal BAC limit, passing the zero tolerance law, and several other successful campaigns from NHTSA. Recent years have seen improvements and a focus on vehicle safety. And as we can see here, so much great work has been done, and there's been an incredible decrease in drunk driving. But the landscape is changing. There's new issues around cannabis impaired road use and alternative forms of transportation or micromobility, riding while impaired. That means that we really need to take some time to re-up our commitment to this issue and take another look at impaired road use. So 1982 was the first year that the National Highway Traffic Safety Administration, NHTSA, began recording alcohol-related statistics. And drunk driving fatalities have decreased 83% among the persons under 21 and 41% overall since that time, which is pretty amazing. As we can see, drunk driving deaths have really dropped a lot, but there's been a slight uptick since the beginning of the decade that goes just beyond the COVID pandemic. So we know that alcohol impairs us on the road, but I also want to provide a little refresher to help us, remind ourselves about the different ways that it makes us more at risk for a crash. The legal limit is 0.08 BAC, but you can still be arrested for a DUI under the 0.08 limit if an officer believes that your driving is unsafe and that you are impaired. Even a small amount of alcohol can affect driving ability, as we see in this chart. In 2023, there were over 2,100 people who were killed in alcohol-related crashes where a driver had a BAC of 0.01 to 0.07, which is under the legal limit. And for anyone under 21, like the majority of college students, there is no legal limit of alcohol that is permissible while driving. That's the zero tolerance law. So going along, we can see alcohol really impacts driving ability exponentially. At a 0.02 BAC, we start to see a decline in vision, a loss of judgment that can make it harder to make safe decisions. At 0.05, our coordination goes down. We can't track moving objects like other cars, bicyclists, pedestrians on the road. Steering becomes harder, and we don't respond as well to different emergency situations that might arise, like weather or other drivers' behaviors, which in the DC area is often erratic. At the 0.05 or 0.08 BAC, which is the current legal limit, we start to see a lack of speed control and impaired perception of our own ability to drive safely, which is the worst time to get in the car, but that's when we might think that we are fine. And then at 0.10 BAC, we really start to see a deterioration with lanes changing issues, reduced ability to brake, and then severe impairment from that point on. So we've made some progress on drunk driving prevention, as we saw, but one of the reasons that we need to take another look at this issue is due to the prevalence of cannabis impaired and other drug impaired driving. Cannabis is the most common drug found in roadside testing surveys and the most common drug found in fatally injured drivers. 43% of fatally injured drivers who had drug test results tested positive for drugs or cannabis in 2015, which was higher than the number for alcohol. And roadside surveys conducted by NHTSA reveal high levels of drug impaired driving. In addition to cannabis, something that college students might not always realize is that legal prescription medications that they might have can also impair them on the road. So it's important to let them know about that as well. And contrary to what students might sometimes say, cannabis impairment does not make you a better driver. Similar effects to alcohol use, slowing reaction time and impairing decision-making ability, distorting perception, impairs judgment, decreases coordination, and impacts lane deviation and following distance. A 2023 survey from the AAA Foundation for Traffic Safety found that, quote, 94% of people say that driving while over the legal blood alcohol concentration limit is very or extremely dangerous, but only 70% believe that it is dangerous to drive within an hour of consuming cannabis. And that's what we have found when we have surveyed young adults in Ohio as well. We've done a lot of great work to reduce impaired road use deaths by alcohol, and that is largely due to legislation and then cultural norms and cultural changes around whether or not it's okay to drunk drive. And so we see when we ask students about their behaviors, about their impaired road use behaviors, and then about how dangerous they think those behaviors are, we see more people are reporting impaired road use while under the influence of cannabis than people under the influence of alcohol, but they think that that behavior is less dangerous than drunk driving. So we've examined some national statistics for impaired road use and talked about trends overall. But what does the risk for impaired road use look like on your campus specifically? So here's a few questions that will help you begin to answer that question overall. And these questions come from an environmental scan, which was developed by a group of stakeholders that the Higher Ed Center has been convening for the past 5 years around impaired road use. So Anthony's going to drop the link in the chat for the environmental scan that will really allow you to dig into these questions even deeper if you'd like, but I'm just going to share a few of them with you now. Firstly, can students have cars on campus, as we talked about? Are there any restrictions to that access? Is there access to rideshare bikes and scooters? What restrictions exist, if any? Is there geofencing that allows students can't go in certain areas, or their speeds have to be diminished in certain areas? Do you have any data on the prevalence of impaired road use on your campus? What do those numbers look like if you do? If you do the NCHA survey, you should have at least 2 data points. Are students aware of the harms and consequences of impaired road use? And if they are aware of drunk driving consequences, what about cannabis impaired road use? Do they know about legal consequences and physical harm consequences for using bikes, scooters, skateboards while impaired? Is your campus rural or metropolitan? And as a result, do you have access to public transportation, or can students walk to the entertainment or similar districts, or do they usually drive or bike? Is there a safe ride program on your campus? Are there many bars and dispensaries near your campus? The environmental scan really digs into that, asking about the radius from campus to those entities. And then, as I mentioned previously, is your campus notified when arrests are made off campus related to impaired road use incidents? Applying the socio-ecological model to impaired road use also helps us to understand the different factors that influence this issue. Traffic safety really is best understood in the context of this model because we're really talking about the whole community here and not just an individual's behavior. But starting at the individual level, students might not have the refusal skills that they need to avoid impaired driving, or the knowledge about safe ride homes in their area or harms and consequences of impaired driving. At the interpersonal level, many Instances when students are at risk for impaired road use occur when students are out late at night, they're in groups, and um, determining a designated driver and things like that. At the institution level, administrators might feel like campus or impaired road use is a community rather than a campus problem. Lack of accessible safe rides and enforcement also exists at this level. Within a community, we're looking at physical roadways and how they have an impact on impaired road use, and creating different situations that might be riskier than in other areas. And regional driving norms also make an impact. Oftentimes there are bars and restaurants near campus that offer happy hour specials to students, and those might increase student access to alcohol. But we think about, if a student's driving to High Street to drink, and then there's um, signage about no overnight parking, then that creates a situation where that person is incentivized perhaps to get behind the wheel, rather than if signage allowed for you to pick up your car in the morning and they could find a safe ride home. At the policy level, our roadways are a highly regulated environment. We have speed limits, signage, different laws and regulations that play into this issue. And at the societal level, we have, many different cultural norms surrounding impaired road use that we talked about. What's considered okay and what's considered not okay. And we've made, a lot of great work, a lot of progress done around those different pieces of culture, but still more is left to be done. So at this point, we've talked about the different aspects of this issue, but what is our role in all of this as people who care about the health, safety, and well-being of college students, and what can we do to help? And this might be an issue, traffic safety, something that you haven't considered as part of your role, but you're just now starting to consider, which is really great. There are many reasons that you should consider integrating impaired road use prevention into your current efforts. Firstly, if your role includes mitigating the harms associated with substance use, then this really does fall well within your scope, as impaired road use results in the highest number of substance use related fatalities on a campus. It's the leading cause of death among college students. College age individuals are also overrepresented in impaired road use, as we discussed, with that 21 to 24-year-old age category. And when we're looking to tackle substance use issues, we want to make sure we do take a comprehensive approach and include issues that affect students from a variety of ways, and this falls into that category. And then lastly, impaired road use is also one of those issues where, once it occurs, it can be really damaging to the perception of safety on your campus. As we discussed and was outlined in the title, it takes a holistic and comprehensive approach to address impaired road use. The framework here on the right, the safe system approach, is used across the traffic safety sector to work towards zero deaths on our roadways, which I think is a great goal. And I wanted to share it here because I really do think that campuses have a key role to play. There is a role for us here in road safety. The responsibility for preventing collegiate impaired road use is shared between all these different pieces of the pie, all these different sectors, not just college administrators. But I think that our role to play falls within this safer people sector through encouraging college students to drive safe and uh, integrating different programs to help them reach their destination unharmed. And there's lots of partners, working within this safe system approach that you can work with to help achieve safer outcomes. And I'd be happy to talk with people further about that at a later time if you want to reach out to me. But I want to highlight one specific partner today, and that is your state highway or traffic safety office. Every state has one, and I'm going to have Anthony drop the link below for you to see who your traffic safety folks are in your state. They are tasked with keeping roadways safe in your state, and they have resources and media campaigns and different programs that you can utilize and just copy and paste right in to do this work on your campus. So we do encourage that you reach out to them and take a look at what they're doing in your state. So how can you begin to address this issue on your campus? There are many ways, and you certainly do not need to do all of these. You can start small, build things up over time, integrate this work into the work that you're already doing. If you have a formal or informal partnership or coalition around substance use on your campus, we encourage you to introduce impaired road use as a potential priority to those folks and get their opinions on what they've seen on campus. You could work to engage various partners on campus, including campus safety, parking, EMS have been great partners. You can raise your own awareness to traffic safety issues on your campus by just chatting with students in your office or at different events about what they're seeing, and dig into your wellness data to see if you have any information on impaired road use. You might and you might not. And you might already have resources to encourage safe road use, like a safe ride program, but you could learn more about utilization rates of that program, whether or not it's best serving student needs, or learn more about a history of a safe ride program on your campus if there was one in the past. And you can utilize some of the media campaigns that we talked about from your state highway safety office, or conduct the environmental scan that we talked about. And then lastly, you can engage students in this issue, which is what my colleague Paige is going to now share about next, and just sharing with you all a case study for engaging students specifically using a data-centered approach.
All right, thanks so much, Liz, for just a very thorough overview of the history and some rates and risks related to impaired road use. My name is Paige. I'm a part of the traffic safety team here at the center. And like Liz said, I'm going to be walking us through a case study for engaging students to address impaired road use. So we developed a training that covers some rates, risks, regulations related to impaired road use, and then piloted it with peer health educators, and then integrated their feedback, insights, and then piloted again with a different social group, which would be the sororities of Greek life members at OSU. And as we go along, I'm going to share different recommendations on how you can engage students as well. I always like to provide an outline for what you can expect me to cover. We're going to be looking at this training in 3 different stages of its development. So we're going to start with a brief glance at some preliminary data. Liz referenced some of those results earlier from one of the surveys that we've conducted. It really informed the training, and it served as a foundation and motivation for the creation of it. Then we're going to discuss some results from conducting the training with peer health educators, those insights that we gained, and then we'll wrap up by looking at some results from piloting that modified training with Greek life and integrating that feedback from the peer health educators. So let's start here. At the Higher Ed Center, we've been collecting data under the leadership of Dr. Lang for a grant-funded project by the Ohio Traffic Safety Office. We're wrapping up a round of data collection now. The results that you saw earlier, and then the graphs I'm about to show you, they're from the second dissemination of the survey, which was in fall of 2024. I want to provide a little bit of context for the survey, how it was distributed, some of the sample demographics as well before we dive into that. It was distributed as an anonymous panel survey in September to October in 2024. So panel survey, we contracted Qualtrics in this case, right? They have a pre-existing pool of respondents, and then they send out, they email listserv surveys that have been registered or contracted for those respondents. We were targeting specific audience, so young adults in Ohio, aged 18 to 24. Overall, our sample size had 701 respondents. It consisted of 28 items, and then it took respondents about 8 minutes to complete on average. We wanted the sample to be representative of Ohio, so we aimed for it to be proportional to Ohio population demographics. We came pretty close. I think our main caveat or deviation that we had a little bit higher rates of respondents from Latina and Hispanic individuals than is proportional to the Ohio population. But other than that, you can see the breakdown of race, gender distribution, and then on the right there, that's the distribution of age between 18 and 24. And we asked other demographic questions, right? We didn't just ask college students to complete the survey. We had young adults complete the survey, so we can look at the breakdown of their enrollment in college classes. For this sample, we had a little bit higher representation for college students at 63%. And on the right, that was a graph that was shared with you earlier, but just again highlighting, this was a survey about driving, right? And we had a pretty high percentage of drivers, which is good. That's what you want to see if you're going to ask people about their driving behaviors. This is the only graph, like data-wise, that I'm going to formally discuss before we're diving into the training. We've done other webinars that really look in depth at the data that we've collected here. But this is illustrating really the primary motivation for developing the training. These data that we've been collecting, they emphasize higher rates among college students of all impaired driving behaviors when compared to their non-enrolled peers. So looking at this graph, right, that left bar, represent our enrolled young adults, and the right bar is our non-enrolled. And you can see in each impairment type, right, that left bar is higher than the right bar. This is a chi-square test. It's the same thing that we just looked back there, the same percentages, just highlighting, right, that these results are significant. This relationship between enrollment and impaired driving behaviors is not, it's highly unlikely, right, that it's due to chance. We have our p-values less than 0.01. And so it's really emphasizing that there is a strong correlation here that we're starting to observe. And it really, beyond, illustrating these higher rates, it illustrates a gap in services, right? Emphasizes a clear need for impaired road use prevention to be prioritized on college campuses. However, right, limited staff time, limited resources, there's infrastructure restraints, you might not have decision-making power. So it's not easy to just start launching a full-blown campaign now that you have the data, you have the information, to start targeting this, head on. And at the core of this project, there's this baseline goal of just starting that conversation. And so that's what we did. We met with a group of pure health educators and student employees at Ohio State University Student Wellness Center. And we had two main objectives here. So providing them with education on risks and regulations, so that when they're having those conversations with students, they feel like they are equipped to address these behaviors, whether preemptively, right, or in conversation if somebody mentions engaging in a behavior. And then also to gain their insights for scaling broader training models for college campuses. And I'm coming into this, with two driving questions. I really think of these as like my own learning objectives internally, my little secret learning objectives. And the main one being, the first one being, what do pure health educators know about the prevalence of impaired road use on a campus? What do you already know, whether it's, statistical or if it's just anecdotal, about how these behaviors are transpiring on your campus? Because, as employees, right, we leave at 5 p.m. and we go home, and that's when a lot of these behaviors are gonna to start to come into play. So to get insight from a student, somebody who's there when these behaviors are occurring, is invaluable, right? And then also, do they have the support and resources that they need to address impaired road use behaviors? And if not, what would be helpful? But we want to set them up for success, and having these conversations, trying to get a little bit of insight into what was interesting to them, and just going with it, right? Like which part of the education stood out to you as resonating as a student, that you think that would be important to continue to build on, and integrate into the wellness initiatives that you're already conducting. This provides almost like a timeline of the training content, how it goes down, so to speak, and starting with the pre-test survey, wanting to get a baseline scale of what your perceptions were, what your understanding was, how ready did you feel before you received this education to address these behaviors. That impaired road use education is really the bulk of the training. So providing those prevalence rates, we do share a lot more data from the Ohio surveys that we've conducted with the students. Risk perceptions, talking about these varying risk perceptions between alcohol and cannabis, and why do these exist, and why should they probably not exist, right? And then also, readiness to address. So providing them with information, right, to then move that into action. They complete a post-test survey before the focus group, right, trying to get those evaluations filled out, and just being able to compare, the effectiveness of the education, and then that focus group that we conduct. And these are the questions that we had prepared for the focus group. It was a great conversation. The students were really engaged. It was very interesting to hear what they found interesting. There was one thing in particular from that graph that we looked at earlier with the rates, and that on the far right there you can see the drowsy driving after having less than 5 hours of sleep was really high. It was like 67% for college students, high 50s for non-enrolled young adults. Overall, it was 62% for the sample. That's really high. And that was like a point of definite interest for the students. They really latched onto that. And it was one thing that they encouraged me, and then, ultimately we did do to build out further and more trainings with other students. So now we can look at some of these pre and post test responses. This is a danger perception question about alcohol. The sample size, again, it was small, it was 5. But we're seeing on the right there, that's what you want to see for the most part, right? We're saying it's somewhat dangerous, it's very dangerous. After the education, there's not that big of a shift. And that really speaks to where we're at with alcohol, right? We've done, as Liz referenced, since like the 80s, like a ton of public health safety education has been out about alcohol. It's been targeted by various levels of implementation. But when we compare it to cannabis, even with our peer health educators, we're seeing them start at this lower perception of danger, or perhaps this uncertainty around cannabis. And we have some more work to do on cannabis, right? It's not a dig at our peer health educators here in any way. This is really a societally, like a social issue, like in our society. And related to this perception, cannabis and alcohol, they do impair you differently, right? They're different substances, but that doesn't make it any less dangerous. And wanting to continue that conversation. And after the training, which is great, shift, right? We see the shift bar there to the right there. So increasing those danger perceptions. And keeping in mind, right, our peer health educators are predisposed to taking education and putting it into action, which is great for these type of conversations. And then, lastly, looking at one of the questions about readiness. So how equipped do you feel to discuss impaired driving conversations with students after the education, seeing an increase in their comfortability and their confidence in discussing these questions, discussing these topics with students. This is an example, like a thematic analysis of one of the questions that was in the focus group. It was on what do you think already worked to deter impaired driving on campus. And on the left, those were the things that they identified as effective. On the right there, those are subject topics, resources that they thought could be further developed. And that campus transportation and public transportation piece was another really great point of conversation with the students. They had a lot of insights, especially with cabs. That's OSU's like campus bus. Being perceived as really inaccessible, inconvenient, really under advertised. I went to OSU for my undergraduate degree, and I think I used cab once. I don't really think I even remember how to use it. I know it was a little bit different than CODA. And then public transportation as well. There being a lack of education on how to utilize the CODA system, and that contributing to an aversion to ride and some safety concerns. And this is a great place to start. In an informal conversation with your students as you're starting to build some readiness on your campus to address this issue. It's just asking them, whether they utilize the campus bus system. Is it useful? How late does it run? The local bus system, maybe you have a rail system, and also gauging some information on their perceptions of safety in using those different resources. Overall, pretty promising evaluations. It really affirms for us at the stage of development that we're at, our commitment to exploring peer-led models. They demonstrated increased readiness. They did walk away with some new information, some increased knowledge. They identified those public transportation literacy, availability as some potential targets for environmental interventions, which is a great place for us to continue that conversation. And then their insights were used to modify and deliver pilot trainings for Greek life on impaired road use. So starting to engage other types of student leaders. And that is where we are going to head to next. Is talking about the next pilot that we executed, but this time with members of Greek life. So there's a couple benefits really to working with Greek life. One big one being that there is an easy access point. They have these training requirements to satisfy their standards of excellence. It's like required education that they have to do to maintain their active status in their chapter. And so it's a pre-existing model that can really be leveraged to get some health education out there on a topic like this that is right now, really underrepresented in wellness initiatives. And that's great. But the tone, like the narrative of wanting to engage Greek life members is really rooted in recognizing them as informal campus leaders. I view our peer health educators as these formal campus leaders. They're really representatives of the wellness center. And I view the Greek life members as these, social, like they define the social culture. At OSU especially, they basically like run football season, we call it block. Apparently, that is not a universal term. I thought that everybody called the tailgate block. They don't. That is OSU specific. I just recently learned that. But they're connected to the university still. So they have these touch points with the university, like these standards of excellence training requirements. But they also have these touch points with students that the university doesn't have really a lot of access to outside of their academics, right? And that's great because they can be these, places where we can plant the seed of information for them to make informed decisions, and then also help other students make informed decisions who might not engage with the school in any other formal capacity. So we did 2 sessions. They were both sororities at OSU. The first one was Pi Beta Phi. We had 39 participants in that training, and then the second one was Delta Phi Omega, and we had 9 participants in that training. So overall, we had 48 aggregate participants in this pilot specific to the Greek life members. And they were able to take these to satisfy either a harm reduction or a member development standards of excellence requirement. These are the 3 pilot learning objectives. They were essentially the same for what we did with the Imperial educators. The main difference being that last one, so exploring campus-specific alternatives to impaired road use and considering potential barriers to implementation. That came directly from that conversation with Imperial educators, and they brought that to our attention. And all right, so we built out an extra piece of the training to address that and start to get more information from a broader student perspective on that. The trainings were conducted, virtually online on Zoom. And so, to try and maintain that engagement, I did build it out in a Mentimeter. I'm sure some of you are familiar with it. And now I'm like super Mentimeter pilled. I think it's like the best thing ever. It's very beautiful. It flows very well. And then it like presents you with this beautiful download of all the responses. It's great. If you haven't tried it, I'm like really selling it. It's hard to get, you can't like get a free trial though. So be ready to commit now to be like a Mentimeter person. But so, trying to maintain that level of engagement, I created a question before each section, just to get the thoughts rolling there. And this was the first question that they answered before the section on rates and regulations. Very, very broad. What do you consider to be impaired driving? And responses, they fell into these 3 main categories that I've outlined there on the left. Alcohol only being really only 3 responses falling into that category. The bulk of responses fell into the unspecified substance general impairment category, which is what we want to see, right? Any type of impairment is impaired driving. And under that right there is that combination of impairment and distraction, which we were really surprised to see. I remember talking to Liz about this, to see this combination of impairment and distraction, because in the traffic safety road, like technically they're different things, right? We view them as different things. We treat them as different things. We don't often overlap in that way. Although, what they're really getting at here, which is true, right, is that this is cognitive like effect of being distracted, of being impaired. And so I found that very fascinating that 5 respondents, responded to that same level. So let's look at some of their evaluation results. This is a really broad, zooming completely out. Overall, did you learn about rates, right? I just talked to you for like 40 minutes. Did you learn something? Did that land with you? Overall, pretty positive. That's what we want to see. And that had this had like a direct learning objective associated with it, right? There was a learning objective about this. So great. There was also a learning objective about this. It's a little more specific, looking at familiarity with policies surrounding alcohol and cannabis, impaired road use, law enforcement legal limits. I spent a lot of time talking about legal limits and the different like caveats that exist. When we talk about cannabis and alcohol, really bringing to their attention, in Ohio, there actually is a per se limit for cannabis, and it's not the same for all states. But talking about that. Talking about micromobility impairment, how you can get an OVI for riding bicycle impaired, for scootering, for skateboarding, anything with wheels, pretty much you can get an OVI for it. And so telling them that, right, and bringing that to their awareness. And so there's a big section about this. So again, this is a direct learning objective. And so that's what we want. We want to see people agreeing with that, right? And then lastly, this question about intervention was not directly addressed in the training. It was not a learning objective. I actually added it after the pilot training had been developed, because I wanted to assess whether education alone is sufficient to inspire like behavioral change, like to inspire action. And of all the evaluation questions that we asked, this was the only one that wasn't really directly linked to content in the session. And it was the only one that had this level of really ambivalence. I read that some would agree is kind of like a maybe not, right? And so that is an area really distinct from what we saw with the Impaired educators. Impaired educators were much more like feeling equipped, even though they weren't offered practical strategies either. But they're predisposed to that, right? They're ready to take education and start applying it. That's part of their job. It's a role. And not a lot of students fall within that category. So when we're looking at other student social groups, other identities, one thing moving forward as we continue to develop the training is trying to start to explore practical strategies for intervention, because it's great, right? To see this increase in education, this increased awareness, that is very positive. We want to see that, and we did see that. But if that education isn't going to be translated into a change in behavior, then we still have some work to do. We have some more development to work on there. And then, lastly, as we're moving out of this, specific pilot stage with these two specific like social groups, thinking about employing the training for broader student bodies and how that could provide additional insights. Both peer educators and Greek life members, they represent a specific type of student. That's an involved student. That's a student who has institutional ties, right? And so it's great because we can easily access them and get their feedback and provide this training for them. But how does this type of training work, and how effective is it with the more general student body? So an overall, reflection on student engagement, and also just, a summary of the session, recalling, the historical overview of impaired road use that Liz provided us earlier in the session. We see the complexity of this issue and also the pressing need to address these preventable fatalities. Nationwide data is showing us higher rates among young adults. We're seeing trends in Ohio that highlight college students at particularly high risk. But it's a big task, right, to launch a full-blown campaign. But these student trainings and other more informal ways to just start raising awareness and building campus readiness are appearing to be effective, right, for addressing it. It's beginning to start that conversation to address impaired road use. Inviting their insight on transportation behaviors, there's risk perceptions. They were really interested in talking about it. I found that the conversations were very engaging for me and them. I learned a lot, which was great. Obviously, as a health educator, you always want to learn a lot from all different types. And learning from the students directly is great, because it's like, what is effective to you as a student? You're going to be a recipient of a program like this. So what will be effective to you? And that can help you generate the momentum right before that broader institutional buy-in exists. So the question, I really want to leave you guys with today, what can start that conversation to address impaired road use on campus? Something small. How can you start to integrate this into those pre-existing initiatives that you already have ongoing at your campus, those programs? And on that note, if you're interested in being a pilot site, or if you just have questions, I'd love to hear from you. Liz would love to hear from you. We have other opportunities. We have other resources to help you begin integrating impaired road use prevention into your wellness initiatives at the Higher Ed Center. It's a big part of the work that we do here. And so that's Liz's email. That's my email. Even if you're not ready or interested in doing anything formally, we do love to hear from you. We love to see what you guys are interested in. If there's anything else from the presentation that we didn't get to talk about, shoot us a question. Yeah, we'd love to hear from you.
Well, thank you so much, both Paige and Liz, for sharing of yourself and your expertise. And now is the time for our audience, if they have questions, to feel free to submit them through the Q&A feature. I do just have a couple of closing housekeeping slides that I would like to share. Again, just a reminder of a few upcoming events that we have at the center. We have our next webinar taking place on May 21st, and it is focusing on an in-depth look at Screen U, and will be facilitated by our very own Logan Davis. Additionally, the applications for the Training Advisory Committee is now open and will be open through June 6th. I dropped a link earlier, and I can drop that again in the chat. You can also find it in the news tab on our website to learn more about what it entails to be a member of the Training Advisory Committee. Additionally, we have the 2025 national meeting taking place here in Ohio, as well as having a virtual simultaneous conference going on in October 21st through the 23rd. And early bird registration will be running through July 18th. Just a friendly reminder that today's session has been recorded, and you can expect to see the session recording uploaded to our website within 3 business days. And with that, I just want to leave again our presenters' emails. If you have any questions or would like to discuss being a pilot site, to feel free to reach out to us either of Liz or Paige or to us at the Higher Ed Center. So again, thank you everybody for joining us, and I hope you have a great rest of your day. Take care all.